So while there's no cure for autism, we're going to go over several effective interventions for children and for adults with autism to help improve their functioning. Hi, I'm Michelle Young, licensed clinical social worker with Mental.Health.Merienda.
And I'm Dr. Adeline Leon, licensed clinical psychologist. There are several approaches that can be beneficial for children with autism spectrum disorder, though it's important to note that treatment plans should be individualized based on every person's specific needs and challenges.
Yeah, definitely. So not every types of things are gonna look similar for two different people with autism. So one type of treatment that's actually quite popular and used frequently for children with autism is something called applied behavioral analysis, or ABA for short. And what ABA involves is, you start off with starting where the child is at, and you do a study of where they are in terms of their functional impairments, their functional challenges. And then as a team, you create very structured, you have like these binders of like very specific, like here's what we're going to work on. But you have this structured behavioral plan for helping to improve that child's behaviors, trying to teach them these new adaptive skills, and then also decrease any inappropriate behavior. So that's something where you kind of have treatment almost like for like 8 hours a day, you have someone coming in and providing that service to a child with autism. But that's a popular one, is ABA.
Yeah, and Michelle, I know that you haven't mentioned it, that you're also an expert in child development, and you've done like all of these treatments that you're going to go over for autism. So I think you're a really good person to kind of really talk to us about it. Like, how long are parents expecting their kids to be in ABA treatment? Is it like for years?
Yeah, from what I've seen, it would be longer than like a year. It's actually something that, and again, it depends on the child's functioning and kind of where they're starting off at. But I've seen kids who kind of participate in this type of treatment for like, a good chunk of their childhood. And again, you taper off as the child gets better and as the child learns more functional skills. So it kind of depends, child to child and family to family. But yeah, this is something that you're teaching, like the skills that, the child is struggling with, and you're teaching it and you're practicing it and you're repeating it over and over again. Same with like the inappropriate behaviors where you're trying to, replace it with a more functional skill. So this is something that like is like almost like you're practicing that functional skill like over and over again over quite a bit of time.
Yeah, it's pretty long term. Yeah.
Yeah. And then also on top of that would be like some sort of social skills training. So this could be done individually or in a group setting, or sometimes you might even have like a therapist or someone kind of come and shadow you and kind of help you practice, again, these kind of social skills like right in the moment. But this kind of intervention helps a lot of children with autism because then it's helping them navigate those social interactions, how they interact with children, their peers, because that is, so social interactions is something that's often like a common symptom. And then another type of treatment, and this wouldn't be done by like a mental health therapist, but this would be done by another professional, a speech and language pathologist, for example, but speech and language therapy. So that also really helps if there are any deficits in language. So this can help improve a child's speech patterns, even just kind of like how they pronounce certain words or pronounce certain sounds, but it kind of helps overall with any language deficits. And then another one would be occupational therapy. So again, that would be done by someone who's an occupational therapist. So not someone that's kind of, so I guess what I'm saying is, and there's often like a whole treatment team to treat autism for children. But an occupational therapist would help to address any adaptive skills, any of those deficits, those daily living. Like handwriting, like how do you hold the pencil? How do you write? So things like that. And again, I'm not an occupational therapist, so this isn't my specific area of expertise, but an occupational therapist and occupational therapy in general will kind of help with those like fine motor skills, those other, any other skill deficits that a child with autism might have.
Yeah, and I think that's something that with autism that we haven't mentioned yet, and that we don't hear mentioned very much. And Michelle, I'm curious what your thoughts are on it, but where it also affects your motor functioning, like your fine motor skills.
Yeah, definitely. That's also a common symptom of autism. And again, that's where the occupational therapists would help with those things, especially too, like we've talked about in previous episodes about sensory processing. So again, that's also something that occupational therapy would help with that. And then a big one too is parent parent training or parent management training, or sometimes we call it psychoeducation. So essentially, when it comes to children, the parent is going to be very heavily involved, of course, in the child's treatment. And so we want to make sure that parents also understand like the purpose of some of these skill trainings and teaching parents, this is how you respond to your kid when they're having a meltdown in public. You don't want to be punitive. Like, here's some skills you want to try at home. So making sure parents get the right support, making sure parents get the right training and, education about how to respond and help their kids with autism is also something that's very beneficial and I think needed for a lot of parents. And then really just having support. Parents need a lot of support because parenting a child with any sort of special needs is going to be difficult, and it's going to come with its challenges. And a parent's mental health is so important. So any type of like kind of parental support is going to be really key. And then lastly, special education services. So sometimes the school district's going to also have to get involved to make sure that the child's education and learning is also being fostered in the school environment. So oftentimes you have something called an individual education plan, or IEP. At least that's what they call it here in California. I don't know if it might go by a different name.
They call it the same here.
Same
yeah. 504 okay. Or IEP.
Yeah, 504. Yeah, 504 plans. Yeah, but that's going to include, again, like an assessment with a school psychologist. And again, you're having the treatment team, the teacher, the school psychologist, anyone else come together and kind of have a plan for this child's education. So any accommodations, so that might, again, mean, someone supporting them, like a one-on-one interventionist, like in the classroom with a child. Maybe the child has to sit closer in the classroom versus sitting further away. So that an IEP, any special education services are going to look different for every child, but we have to also kind of think about their education and like what are some accommodations a child might need because of their autism to help their overall learning, and then also how they interact with their peers.
Yeah, so definitely sounds like, Michelle, with treatment for children with autism, that it really involves a whole team of people and being able to address all different areas of a child's life and hoping to help them improve in their social functioning, speech, and their occupational functioning with handwriting, motor skills, involving the parents, the school. It definitely is a very big team effort.
Yeah, it's definitely not one person can kind of like do everything. There is a whole team, different professionals, different experts, working on different aspects. And again, like we're looking at the whole child, and for them to be successful as a whole. So definitely it's not your, just 1 hour of therapy once a week type of treatment. It is very, very involved. And you're also including like, teachers, other, the parents for sure. So yeah, it's very holistic.
Yeah. And so as far as treatments for adults with autism, there is some overlap between the treatments for children versus the treatments for adults, but I'll be focused on the ones that are more oriented for adults. So number one is cognitive behavioral therapy. You've heard us mention it so many times, CBT. We will continue to mention it because it's evidence-based. It just has research backing it up and showing that it can help with so many different mental health conditions. And so when it comes to autism, that you can also come along with feelings of anxiety, depression, even improving social skills. And so, with autism, you can have misperceptions about social interactions and maybe perceive them as very negative. And that can be part of the social difficulties that you have that are part of your autism. And with cognitive behavioral therapy, you can address maladaptive thoughts and use cognitive restructuring to help with those. And so as long as the person is this would have to be for someone who has higher functioning autism spectrum disorder, and that CBT could be very effective for them.
Yeah, that's super interesting. Yeah.
Mm-hmm. Yeah, I know. Yeah, I haven't done CBT with anyone with autism myself, but I can definitely see how that would be really, really helpful. Social skills training, which Michelle mentioned as well. We can have this for adults as part of individual therapy. And so the therapy modality can also focus on improving interpersonal interactions and understanding social cues. So a little bit of kind of what I mentioned with CBT or another therapy framework could also incorporate social skills training. And then related to that, number 3 is life skills training. And that focuses on improving independence and functioning in different areas of life. So when you think about like things that adults have to do, like we have to budget, we have to manage our finances, we have to, keep up our house, like we have to, self-care things and things that doesn't necessarily apply for kids. Like, their parents are the ones who are doing all of those, but that can be difficult for autism to manage different skills like that. So that can also be part of someone's individual therapy. And then number 4 is mindfulness and stress reduction techniques. So that can help with emotional regulation and anxiety management. And so with autism, you can have different heightened emotional reactions to things. And so, I think about like sensory processing and how it could be almost aggravating, or it actually can be aggravating to be exposed to too many senses and be overly stimulated. And so, how do you deal with that irritability and that anxiety and that agitation? So, mindfulness can really help with being very attuned to your body, being very attuned to managing your emotions a bit better. And then that can be really good, really helpful.
Yeah, it sounds like with adults with autism, part of treatment is also managing any like co-occurring diagnoses. So anxiety is probably a common co-occurring, or depression. And so all these things also address those. Would you say?
Mm-hmm. Yeah, definitely. Mm-hmm. And then there's vocational rehabilitation. So vocation referring to jobs. So that can assist with job skills and employment support. That wouldn't necessarily have to be a mental health professional. It could be a vocational rehabilitation counselor who could do that. Again, it could also be part of your treatment, part of your therapy, depending on exactly what kind of mental health professional you're seeing. I know in my role way back in the day when I was a social worker, part of what I did is I did kind of some therapy and some case management, and I did some vocational assistance for people and kind of helping them with finding jobs that were a good fit for them. Like we would look through job postings and talk about them, and then we would talk about, do you think this one's a good fit for you? Why do you think it is or isn't? And kind of things like that. And so I think that could be really helpful for someone with autism and trying to find a job that's the right fit for them and for their level of functioning at that time, because that could be a challenge.
Yeah, definitely. Again, like those social skills and interactions all kind of like weave into even adulthood. These are things that, you need that support in those areas.
Mm-hmm. And then lastly is support groups. So this provides peer connections and shared experiences. So we had mentioned this in a previous video about autism and neurodivergent and social media. We'll make sure to link that down below if you'd like to check that out. But we talked about how people sharing their experiences with autism on social media, it can help build a community. It can help build that connectedness, except that sometimes that information is not completely accurate, or it can't be applied to everyone. So support groups with people who have been diagnosed with autism, it's a way to get that belonging, but facilitated by someone who's a mental health professional, a licensed mental health professional. So that's a more effective way of actually getting that community and that belonging and support.
Yeah. I love all those. So there's also, and I think, you've mentioned some that are, kind of common treatment that would also be applicable to children. But for both adults and children, other treatments that are going to, be needed for both would be, again, and I mentioned this earlier, treating anything co-occurring. So it seems like it's very common for adults where there might be a co-occurring condition like anxiety or depression, but same thing for children. So children and adults with autism are actually more likely to experience other conditions like ADHD, and we mentioned anxiety and depression, but even intellectual disability or insomnia, more so than individuals without autism. So those conditions also need to be addressed in addition to the autism. So any type of treatment that also addresses those conditions are also needed. So this could look like therapy, again, for kids and adults, and then also medication. So making sure we're treating the whole person, not just, one diagnosis, because oftentimes you see that there's a co-occurring condition. And then medication. So medication is going to be a big part of treatment for both children and adults. So what's going to happen there is that you're going to meet with a psychiatrist who are going to evaluate, your autism, if you have it, and then also any other mental health conditions that are co-occurring, and then prescribe medication if that's the appropriate way to treat. And so for autism, I think you mentioned this earlier, Adeline, sometimes you have that irritability, right? That autism related irritability can be common. And so medications can help reduce that irritability. Again, it's going to be prescribed by someone who's licensed, who is, well trained and all of that. But medications such as risperidone would be common to help to treat that kind of irritability that might be common for some people with autism.
So we hope that you found some helpful information here in this video. Make sure that you tune into our other videos to find out more about neurodivergent conditions like autism, as well as other mental health conditions. Thank you for watching.
Bye.
Bye.